Thank you, Michael. We'll go to Ronnie Cowan, please, be followed by David Mundell.
Thank you very much, Chair. I'm developing a mild obsession with how we got into this mess that we're currently in. And I'm curious if all this planning was done up front before any crisis came along, were we ever considering the fact that we could face this particular crisis, or had it just never been on the radar?
It's a very good question. The Cabinet Office and the Emergency Plans, the Civil Contingency Secretariat, maintain a dossier of threats to the country's resilience, and an enormous amount of work was done to anticipate a flu pandemic, and work was also done to anticipate a SARS-style outbreak. But what wasn't anticipated, and I think this is true worldwide, was the impact of a virus quite like COVID-19 that combines elements of the flu pandemic, and obviously it has a relationship with a SARS-style outbreak. In the past, sorry.
So I'm surprised you're bringing SARS into this, because Taiwan learned very much from the SARS outbreak, and because of what they learned during that outbreak, they took a completely different approach to attacking COVID-19. They went for a track and trace and contain from day one, very aggressive, and shut it down at source. On the 23rd of January this year, Matt Hancock said in House of Commons, the public can be assured that the whole of the UK is always well prepared for these types of outbreaks. And I'm sorry, I'm not going to witch hunt here. I just cannot see that panning out from there to where we are now.
Well, I'd say two things. I mean, the first thing is that different countries have approached the pandemic in different ways, but there is a significant amount of overlap in how countries have approached it. And we have a fantastic contact tracing facility and capacity in the UK, and we were contact tracing at the beginning, but we had to change our approach as the nature of the virus changed. This is a new virus. We've only known about it for 4 months, and the world the world's scientists are learning about it. With respect to preparation for a pandemic, we had a stockpile of PPE and we had legislation ready to go as a result of the work that had already been done. So the Coronavirus Bill, or Act now, which was agreed across all 4 governments, the fact that those legislative provisions were in place was because of work that had been done by the Cabinet Office, the Department of Health and others to put us in a strong position. It was the case also that the stockpiles for a flu pandemic have helped, but there were additional requirements because of the specific nature of the virus, which, following scientific advice from the Advisory Committee NERV-TAG, we sought to source to complement the pandemic stockpile.
But the mere fact of our stockpiling equipment and PPE says to me, we decided the battleground, if I can use that language, was going to be in the ICUs, was going to be in the care homes, rather than taking it to it and fighting at the airports, fighting at the seaports. Why do we not do that? On the 3rd of March, I asked the CMO and again Matt Hancock, what are you doing about ports, seaports and airports? And on the 3rd of March, they did not have an answer. And today, I still don't see that answer.
Again, it's a fair challenge. Different countries which have had restrictions, for example, on flights, have had a similar or even greater incidence to countries that have had fewer restrictions on flights. So it is the case that the science and the evidence is accumulating at the moment, and all of us are learning as we go. Now, the work that was done in Exercise Cygnus and in other exercises undertaken by the UK government was designed to anticipate what might happen in a flu pandemic. As we discussed earlier, the precise nature of this virus meant that that response had to be recalibrated, but that work was clearly helpful in preparation for this. But if we look across the globe, and in particular if we look at other European countries, we can see that they have faced similar challenges. They faced particular pressures on their health service and on ICU capacity, and whether it's been France, Germany, Italy or Spain, all of those countries, as I say, have faced a similar scale of threat, and we are learning from those countries as they are learning from our own experience, what have been the most effective and best targeted responses.
And yet a small island nation of a population of 5 million people like New Zealand seems to have done it a whole lot better.
Well, again, New Zealand has a specific geography which has provided it with a different set of challenges. But if we look at the United Kingdom, there are factors, and here these are factors to be borne in mind. They're not definitive, which is important to bear in mind when we think about the spread of the disease. One of the things we know about the disease is that it spreads, as we have become aware, through social mixing, and it spreads faster, or appears to have spread faster, in cities. If you have an open, dynamic, multicultural, multinational, free trading nation like the United Kingdom, and you also have significant cities of the size of London, Birmingham, Manchester, and Glasgow, then it is the case that you are likely, on the basis of what we know so far, to have a faster rate of reinfection than in other countries. Now, again, it is perfectly legitimate and necessary for people to ask questions and to challenge, but this is a developing picture, and I think it's important that all of us have a degree of what a philosopher might call epistemic modesty in making sure that we don't overclaim for our ability to determine exactly how the virus is going to respond to interventions in the future.
As well as epistemic modesty, could we have perhaps briefer answers as well? If I could cut across to David Mundell, followed by David Jones, please.